We welcome you to Consumer Times News. We are taking health-related issues in association with Dignity Care India Trust, creating awareness about good health and involved in helping and serving people in health-related issues, and bring you health-related services and products at affordable price and serve the deprived section of society. If you think our effort is in the interest of large number of persons and want to know more about Dignity Care India, please visit our website www.dignitycareindia.com, and do not forget to like, share and subscribe our videos to motivate us to bring more videos.
Vitamin D deficiency is common in elderly patients with diabetes. Vitamin D deficiency contributes to both the initial insulin resistance and the subsequent onset of diabetes caused by beta cell death. Vitamin D acts to reduce inflammation, which is a major process in inducing insulin resistance. Researchers published the study covered in this summary on researchsquare.com as a preprint that has not yet been peer-reviewed. Low serum levels of vitamin D were significantly associated with a higher prevalence of diabetic foot ulcers in elderly patients with diabetes. Average serum levels of 25-hydroxyvitamin D, 2,5-OHD, vitamin D3, the major circulating form of vitamin D in people, steadily decreased as the severity of diabetic foot ulcers increased, as measured by the Wagner classification. Elderly people with diabetes should undergo routine vitamin D screening or receive vitamin D supplementation to prevent the onset or improve the prognosis of diabetic foot ulcers. Vitamin D deficiency is common in elderly patients with diabetes. Low serum levels of vitamin D were significantly associated with a higher prevalence of diabetic foot ulcers in elderly patients with diabetes. Average serum levels of 25-hydroxyvitamin D, 2,5-OHD, vitamin D3, the major circulating form of vitamin D in people, steadily decreased as the severity of diabetic foot ulcers increased, as measured by the Wagner classification. The relationship between diabetic foot ulcers and vitamin D levels is controversial, with conflicting data. This is the first study to assess vitamin D levels in elderly patients hospitalized with a diabetic foot. This was a retrospective analysis of 339 hospitalized patients with type 2 diabetes aged 60 to 90 years seen between January 2020 and March 2020, including 204 with and 135 without diabetic foot ulcers. The study included patients who met the 1999 diagnostic criteria of the World Health Organization for diabetes and diabetic foot ulcers, but excluded those taking an agent that can affect serum vitamin D levels. The average age of participants was 67 years old and nearly two-thirds were men. In the multivariate analysis, independent significant protective factors for diabetic foot ulcer were higher levels of 25-OD, triglycerides, and HDL-C. Factors that independently linked with an increased diabetic foot ulcer risk were prolonged diabetes duration and elevated systolic blood pressure. Overall, 80.5% had vitamin D deficiency, defined as 75 nanomoles, L or greater than 30 nanogram per milliliter. 24% had levels defined as insufficient, 50-75 nanomoles, L or 20 to 30 nanograms per milliliter, and 73% were deficient. Among those with a diabetic foot ulcer, 2% had sufficient vitamin D levels, 13% had insufficient levels, and 85% had deficient levels. The differences between these rates and those among the people without a diabetic foot ulcer were significant. Level of 2,5-OHD significantly decreased with increasing severity of diabetic foot ulcer based on Wagner grade. People with the lowest grade diabetic foot ulcer, Wagner 1, had on average more than twice the serum level of 2,5-OHD compared to those with the most severe diabetic foot ulcer, rated as Wagner 5. The study was cross-sectional. Well-designed, prospective studies are needed to assess the causal relationship between vitamin D and diabetic foot ulcer risk, and to explore whether vitamin D supplementation has any effect on diabetic foot ulcer treatment, the authors said. The results could provide clear evidence for using vitamin D supplementation for prevention and treatment of diabetic foot ulcer in elderly people with diabetes.